I'm Suzanne Sibylla. I'm the owner of Sibylla and Associates, which is the premier leadership and employee development company. Overcome obstacles, reframe your reality, love life, and have growth goals. Change and shift your energy. Pivot. Welcome, everyone. I'm Suzanne Sibylla, your host of Pivot Now, where we bring on interesting, exciting, and dynamic guests who will share with us their tips, tricks, and life and business hacks to help you pivot in your life. I am super excited to bring this guest on our show. She's absolutely amazing. You're going to love her. Let me tell you a little bit about her. So she's a functional medicine doctor, and she helps women in the ages of 20 to 50 years old to help them with their fatigue and their level of dreariness and upset, to help them medically. And she does functional medicine. She's so amazing. You're going to love her. So welcome to our show, Ailina Ishmael. Welcome.
Hi, everyone.
Dr.
Thanks, Suzanne.
Ailina.
Thanks for having me.
On the show. Wow.
Hi, everyone.
It's super exciting.
I love the introduction. Thank you.
Yeah. So you've got to tell us a little bit more about what you do and what is a functional medicine doctor.
Okay. So at least how I explain it, usually it's conventional medicine. And don't get me wrong, conventional medicine, we need it. It's not bad. We actually, hopefully we can work together, conventional and functional. So say you are in an accident, you break your leg, or you have a heart attack, you need drugs, you need surgery, or if not, you can die, right? So that's in acute medicine, conventional medicine is really good in acute illnesses. But functional is more looking at chronic illnesses, more looking at the root causes. So not everything is about a pill for an ill. Some things, you need to look at the root causes, your environment, your lifestyle, how you move, how you sleep, what are your stresses, your relationships with people around you. So all of those come into play, because then they can be the antecedents or the triggering factors that can cause all your chronic illnesses. So that's how I explain conventional and functional medicine.
I love that because you're looking at the whole person. I mean, holistically looking at them, right? Yeah. In terms of their diet or nutrition, like you said, their sleep, exercise, physical activity, stress levels, relationships. I love that. And so then what do you usually advise or recommend for people if they're feeling that sense of fatigue, or because I know I work with a lot of women and they're feeling that sense of overwhelm or fatigue, and especially during the holidays. So what advice do you give?
I call it like a pyramid of dysfunction. So imagine if it's like a pyramid, if we don't address the base of the pyramid, then there's no point looking at further up along the pyramid. So I get a lot of patients with autoimmune diseases, especially in women. It's more like thyroid, so Hashimoto's disease. So they come to me and they say, fix my thyroid. But I say, let's look at the base. So there's 4 things to the base. There's the mind, emotion, and trauma. So if you don't address things that have upset you currently, in the past, we talk a lot now about transgenerational trauma. I don't deal with it specifically. I just try to dig it out. And then I refer to the appropriate, psychologists, counselors that can work with them. But those things need to be addressed, because sometimes after they see me for a while, on paper, everything looks good. Your investigations, the numbers are all good, but they still feel fatigued. They still have body aches. So then we're like, there's something not right? So you got to go deeper. So if we can address that at the start, that's good. Second, obviously, is current stresses. So, family, life, kids, work, all of that needs to be addressed. Third is sleep. So if you don't So some people say, oh, I do get my 7, 8 hours sleep. The next question that I always ask is, do you feel well rested when you wake up in the morning?
Mm.
And a lot of people say no, because they don't get the deep sleep, or they keep waking up in the middle of the night, can't go back to sleep. So sleep is huge. And the last part of the base is your upper gut, so your upper gastrointestinal system. Always a lot of people say everything starts in the gut, and people usually concentrate on the lower gut. But sometimes, when you think of the gut, it's not just the intestines. You start from your mouth, how you chew food, how your saliva is produced because there's enzymes there, and then how it moves down your gut. So I call it from your gums to your bum. That's your whole gut.
Comes to your bum. I love that. That's great.
And we look at, things like, as I said, the chewing, mastication, how you, even further up, your brain, how does your brain perceive like the smell of the food, how the food looks like. So everything has to be enticing. And then acid. So your stomach produces acid, and a lot of people, unfortunately, currently are on antacids for their reflux symptoms. Helicobacter is a bug that sits in your stomach that causes a lot of problems. Your pancreas, is it producing enough enzymes to digest the food? Because a lot of people come with nutrient debt. Is it just that not taking the nutrients, or the nutrients are not being digested and absorbed into their gut? So those would be the things that I would look at initially.
Wow, it's a lot of things. That's pretty
It is.
amazing. So then, tell me a little bit more about that, because I know that you've pivoted a lot in your life and your business. Can you tell us how you did that?
So I still practice a bit of conventional medicine, but mostly it's now functional. Why? I've got 3 kids, and 2 of them are on the spectrum. And
Oh,
in my days, years ago, now I sound old, um, maybe autism was mentioned like for 10 minutes in the whole psychiatric lecture. Like we didn't
hmm.
talk a lot about autism. So my firstborn, she's autistic, quite moderate. So I had to do my own research. And the
Mm,
problem with conventional medicine is, oh, she couldn't talk, let's send her to a speech pathologist. Or she couldn't write, let's send her to an occupational therapist to work on her
mm,
muscles, which
hmm.
is fine. But I felt that there was more. Like, again, downstream, they were addressing downstream problems, symptoms, whereas I wanted to look at more. So that's how I got into functional medicine. I started doing my own research, things that we don't learn in medical school. And that's how then I got into, like, things like environmental toxins, her gut, her brain inflammation, her brain's biochemistry, and how to address that without going into medication. Because a lot of kids now, unfortunately, they are being medicated, and it's scary. Some of them are on adult doses. It's scary.
Yeah, that is so true. I mean, and there's more kids being diagnosed with autism or being on the spectrum, and more like learning differences or learning disabilities. And so it's great that you're actually looking again more at the root cause. I mean, so can you tell us how you helped your kids with that, with regards to autism? I'm really curious about that.
My daughter's 25 now. She's not perfect. She's independent, like in terms of she's quite functional, but still, in terms of stranger danger and things like that, she's quite vulnerable. So that's why they call it a spectrum, right?
Hmm.
Some people are quite high function minor, some people are more severe, and she's got intellectual disability. But at least now she can function on her own. We do have, like, she goes out with carers at times, but it's good to know that, and you do as much as you can rather than just, wait for medication, or just, rely on allied health. So I work a lot on her gut. We look at gluten, dairy. Those are huge things in some people, not everyone. There's lots of studies in autism, how then it gets through your gut and then goes to your brain and causes a lot of brain inflammation. So
Mm.
yeah, that's the, and my son, so my youngest son, and the third one, he's now 17. He couldn't speak at when he was 4, and it was hard to accept another diagnosis of autism at that time. And there's always this mom guilt, right? It's like, oh my God,
Mhm.
what happened during my pregnancy, blah, blah, blah. Now he's got like verbal diarrhea. It's like, oh my God. Like,
Wow.
yeah, he just,
Uh-huh.
so, and then I'm like, I want to complain and say, oh, stop speaking. And I'm like, oh no, I should be grateful. Like, he wasn't speaking at all. He still has some social issues, but he's more high functioning compared to my daughter. And then that's my first son. He's neurotypical, but he's got the middle child syndrome. He gives me the most grief in a good way. It's challenged me. All three have challenged me, but that has made me grown to be a better person, to be more humble, to know that we take learning, like we think learning is so easy for kids, but when we had to teach our kids on the spectrum, you have to break down every single step, right? I'm like, oh my God, like for some people it's not easy, whereas others, kids just learn from how other people speak, they
Mhm.
mimic people, but kids on the spectrum, you got to break down those things. So it was quite a humbling experience. It still is a humbling experience.
Yeah, it's amazing that you've been able to do so much, with your kids and then learn through all of that too. I mean, I know it teaches you patience because I know we're dealing with that as well. But in terms of learning differences and such, with our son. And finding too that how nutrition really plays a factor in all of that too. I mean, with regards to gluten and dairy and the dyes, that are there, like the red
Oh,
dyes, blue dyes, and all of that. So it's
artificial colorings, yeah, sugar, processed
sugar,
food.
definitely sugar. Yeah, definitely
Yeah.
plays into it as well. So yeah, I want to know more about. So you look at that too with regards to adults, in terms of what they're eating, their nutrition, and all of those factors. Uh, can you give us a little bit more with regards to? We do this part of the show. We call it 3, 2, 1, go. So give us 3 tips, 2 strategies, and 1 action item to pivot our lives forward.
So 3 tips. Okay. You gotta listen to your body, right? So
Hmm.
if you got the fatigue, the brain fog, the body aches, and they are signals. They're telling your body something. It's not just symptoms. It'll be okay and all that. Don't listen. You gotta pay attention to them. It's your own body. You got to advocate for your own health. So if you
Hmm.
go somewhere and your practitioner says, oh, your blood all came back normal, don't worry, it's all in your head. No, really find the root causes. So that's number one, listen to your body. And then secondly, you got to embrace change as
Hmm.
growth, right? Every pivot, every is an opportunity. So if you have a problem, address it, invest in your health. Prevention is definitely, better than cure. It'll cost, you think that by like, investing in nutritious food might look expensive now because, you can organic food, healthy, unprocessed food is more expensive, sadly. But use that as an investment, embrace the growth because then long term, you'll have to spend less on trying to cure whatever illnesses or diseases that you have,
Hmm.
right?
So
So
true.
you got to align closer to your true purpose. And the third one is prioritize yourself, right?
Hmm.
Like we moms, I call it ourselves like super moms. We try to do everything, but you can't pour you can't pour from an empty cup. I call it. You
Mhm.
gotta
Mhm.
invest in your own health and well-being. So that was the three
I
tips.
love that. I love that. That gives you the hearts on the fire. That's so great. Definitely invest in yourself and really listen to your body and definitely self-care, nurture yourself. That's really
Yeah,
key. I think so many of us as moms, focus on our kids, on our spouses, our partners, and work and all of that, and we neglect ourselves, and we
Yeah.
think, oh, self-care, well, I don't have time to do a manicure or a pedicure or do the massage. It's not that, right? It's the simple things that we do in our life and our lifestyle. Like, what are we eating? Are we getting enough rest? Are we doing some physical activity? And it doesn't mean that you have to go out and, run a marathon or do, hours of exercise. It could be 15 minutes a day. So I'm really glad that you spoke about that in terms of self-nurture and listen to your body. That's excellent. So what
Yeah.
are the two strategies in order to pivot our lives?
A lot of people come to me and they say, oh, so how do I get better? What's the best diet to go? Because there's so many diets out there. I say, no, start small, stay consistent, right? Start with small steps. So, let's just start with a smaller plate. Start with just, a quarter carbs, quarter proteins. Half of it should be filled with vegetables and fruits, the color of the rainbow. Oh, I need to exercise 10,000 steps a day. That's what everyone says. But if you've never even gotten off the couch, start small. Maybe do 2,000 steps a day. Maybe just walk to your front, like post box, daily. So tiny actionable steps, they build momentum and then you lead to lasting change. If you go all out at the start, you probably get burnout, you think it's too hard, and then you just give up.
So
The second,
true. I say that to my clients all the time. I love it because we're on the same wavelength here. I love this.
I
I
think
know
it's
some,
common sense,
yeah,
right? But
yeah,
people don't think about it. So
yeah.
sometimes you just have to remind
Yeah,
people. Yeah.
exactly. It's taking those small actions, right? Instead of thinking, oh gosh, especially right now. Well, we're into the holidays, and then when January 1st starts up, people are in their New Year's resolutions, and I don't believe in New Year's resolutions, right? They want to like, okay, I want to lose weight. I want to lose 20 pounds, and I'm going to go and exercise. I'm going to go work out at the gym, and I'm going to start eating better. I'm going to, and they do all these things. It's like, and then maybe the first month they're doing great, and then by February, March time frame, it starts to go back to how they were before.
Yeah.
So I always recommend like take those small actions, like you
Yeah.
just said. So
Yeah.
amazing.
Even
Love
from
it. Love
today.
it. Love it. Love it. That gets the heart in the fire. That's
Oh,
so
yes, so
great.
much fun, Suzanne.
Yeah.
And then obviously the second strategy for me would be what we've talked about before, addressing the root cause. So whether it's the stress, diet, sleep, identify the underlying issues rather than just treating the symptoms. So that's really the two strategies that I like to talk about. And the last one, the action item, if you're not sure where to start, it's like, oh my God, brain fog, body aches, tired. Later on, I'll share with you, like, I've got this fatigue decoder assessment, and then you can look at it's a 5 minutes. You look at the hidden causes. Is it your hormones, specifically thyroid hormones? Because I deal with that a lot. Female hormones, people go through perimenopause, which can last 2 to 10 years. Then that leads to insulin resistance, blah, blah, blah. And your gut. Remember I said the gut can be one of the root causes of your chronic illnesses. So you got to take action, and sometimes it's just 5 minutes to then look at things further along.
Wow. Fantastic. Fantastic. So when you talk about the gut, because I hear that a lot, oh, it's the gut,
Yeah.
it's the gut health. Tell me a little bit more about that. Tell us a little bit more about that.
So a lot of people say like, oh, I'm reacting to food. I start off with maybe dairy makes me go to the toilet, and then now I can eat like, have you heard of low FODMAP? So people react to garlic, and then it's onions, and it's like so many things. So a lot of people think if it's food related, it must be the gut. But sometimes it could be your immune system, because 2/3 of your immune system sits in your gut wall. Like, because the body knows if there were anything to get in through your body, it's through your gut, because whatever we stuff into our mouth, what we drink, what we eat, ingest. But of course, you can inhale a foreign body. If you cut your skin, you might get bugs coming in, but mainly it's the gut. So the gut itself is not, the body's not stupid. It says, okay, let's have two lines of defense mechanism, and one of it is 2/3 of your immune system actually sits in the gut wall. So when people come with food sensitivities, intolerances, sometimes it could be starting at your mouth, remember, upper gut. And if for whatever reason your immune system is down, it doesn't develop oral tolerance. So it's like it looks at food and it thinks it's public enemy number one. And then that just starts a whole cascade of like immune reaction. And that's why then you get headaches from the food. It could be an abnormal rash, rosacea. It could be like gut symptoms, bloating, pain. So it might be an immune system, not the gut. But then also the gut has a defense mechanism where if you look under the microscope, the lining of the gut is about like a one cell layer. And we have this tight glue in between the cells. They're called tight junctions because they're supposed to keep all the bad stuff out, right? And then there's these little channel doors that might open up and absorb your vitamin D, your iron, and other nutrients. But in some people, certain foods can break down that glue. And that's when you coin the term leaky gut, and then stuff that should come up your poop gets reabsorbed back. Some of the enzymes that break down histamine. So a lot of people come with like a lot of eczema, hay fever, and all that. Histamine is not broken down in the gut because the gut's not happy. Then histamine gets reabsorbed. So you've got this continuous increased histamine levels. Or if there's an enzyme that breaks down estrogen in your gut into its active form again. So estrogen usually is deactivated in the liver and then comes up through your gut, and you should poop it out. But if the enzyme's not there because the gut's not happy again, the enzyme's there, it's a different enzyme, it's there and it breaks down this estrogen, inactive estrogen, gets recirculated, then that's people with estrogen dominance. So breast cysts, endometriosis, sometimes female cancers, because now you've got estrogen dominance. And the last one, most people last example, it's like lactose intolerance. So when people eat dairy, the sugar doesn't get broken down in the gut. So then you get diarrhea. So the gut is huge. Like you got to look at what you eat, how you break it down, how you digest it, how you assimilate, and how you poop. So if you're not pooping every day, that's another favorite question of mine. Are you pooping every day? And how does your poop look like? So if you don't know what I mean, Google the Bristol stool chart. Ideally, you want your poop to be like a sausage, kind of corn on the cob, and you have to poop every day. If not, all the waste products might be recirculating back into your gut, especially into your body, especially if you got a leaky gut. So there's so many aspects to the gut itself.
Wow, that was very comprehensive there.
Yeah, too much. Yeah, that's why I say.
Thank you. That was great.
Yeah.
Yeah. This is fabulous. So how can we connect with you? Where can we find you?
I'm mostly active on Instagram. So my handle is just Dr. Ailina, my name, Ailina. There's lots of free resources there. And then there's a link, as I said, remember the one strategy would take my fatigue decoder quiz. It'll uncover the root cause of your fatigue. And then that's when you can go on and look at what are the root causes that might be yours that can cause the fatigue, body aches, brain fog. And you can also book like a free one-on-one consult. Remember I said how some people say, I have all these symptoms, I go to my practitioner, they say everything's normal. We functional doctors look at blood work in a slightly different way. So that's the healthy range. In conventional medicine, imagine it's a healthy range, and after that you've got disease, right? So it's either or. Whereas our range is still within the healthy range. It's more narrow. It's called the optimal range, where you're living your best life. And then if it gets slightly out of that, you could be like, amber light saying, oh, maybe that risk factors. And if it goes further into the red zone, okay, that's red flags. We need to act now. So our ranges are more narrow. So that's why when you say your bloods are normal, when patients come to me and they say, my other doctor said it's normal, it must be something else. I said, can I have a look at those blood work and let's work through that? Because blood tests are like easily done, right? And you don't have to do complicated things like zinc is, for example. Even if your zinc is low and in Australia you have to pay for a zinc test, just looking at other markers like your liver markers, your kidney markers, sometimes from there, from your blood work, like full blood count markers, you can decipher like, oh, your zinc is low, and then just start taking zinc as a supplement or zinc from food. That was the last thing. You always use food as medicine. That's the goal, right?
Yeah. Yes, I
You
love that.
can, yeah, you might need supplements at the start to boost things if it's like you're really in nutrient debt, but after a while, always look at food as medicine.
Yeah, I love that. I love that as looking at food as medicine. That's fabulous, and I love talking to you about all of this. I mean, this is great and really great information that you gave us, and wealth of knowledge and
Thank you.
expertise. So, thank you so much for being on our show and giving us all this information. Love it so much. And yeah, so people can connect with you. And if they want a one on one consultation, they can also do that as well. And we'll have all your social media links as well so that people can connect to you after our show and all of that. So that's fabulous. Anything else you want to add that I didn't ask you about or?
How I'm like, I've got a busy offline practice, but in the last few years, I've been pivoting online because I find that now I see like clients from interstate and a few from other countries. So that's why I wanna help more women. I find that like a lot of people do not know where to go. So I do have like a 12-week online program if that's something. Because the other thing I find with my offline patients is they probably see me once a month or maybe 3 months. You go away because I can't clone myself. That's the thing. So they go away. Some people do really well. They come back 3 months and we move on. Some people just fall off the bandwagon because there's no accountability. With the online program, there's always these weekly check-ins. There's a form sent out. Do you have lots of your red flags, orange, or everything's green? Then we might have a 10-minute, one-to-one consult and then tweak things a bit in the program. So that's the difference in terms of the online versus the offline program.
Yeah, I know that's fabulous. I mean, I have online, I mean, all of my clients are online in different countries, different states. So it's great to be able to do that. And as you said, I think accountability is so key because a lot of times people can have that information. We know what we need to do. It's the implementation, right? It's taking the action and
Yeah.
having someone that holds you accountable for those actions, I think is really key too. So that's great that you have that program.
Thanks, Suzanne.
Yeah, yeah.
Thanks for having me. Like,
Yeah, really appreciate having you here. And thank you, our viewers, for watching our show. We're here every Tuesday, 10 o'clock Pacific time, 1 o'clock Eastern time. And we're doing amazing things. We're pivoting all the time. So pivot your life forward, live life abundantly. Pivot now. Woohoo! Let's go, people. Change and shift your energy. Pivot